Good afternoon to everyone, and welcome to Healthy Living with a Vision's Town Hall on Alopecia Awareness. My name is Chanel Brandon, and I'm the Secretary of Healthy Living with a Vision. And I'm honored to be on this call this afternoon with all of these wonderful people. And we have such invigorating information to give to you guys today. So, first, I want to tell you a little bit about Healthy Living with a Vision. Healthy Living with a Vision Foundation, it's committed to transforming health disparities in historically underserved communities. By empowering individuals through health education and economics, the foundation will assist in removing systematic barriers of access to care. The foundation utilizes cutting edge technologies and research to provide robust healthcare. And our vision, Healthy Living with a Vision Foundation, sees world where there are no healthcare disparities in groups of people because of race or economic situation. The foundation sees a society where individuals are empowered and manage their own good health and wellness with knowledge and innovative technologies. So that's a little bit about us, and I'm so grateful to be a part of this wonderful organization. So today, first, Dr. Johnson is our CEO. He's on the call. Wave, Dr. Johnson. Say hi. Awesome. And then we have wonderful speakers on today. We have Dr. Stockton. Donna Stockton. She's a board certified dermatologist from Mokina, Illinois. And then we have Keya Trammell, who is a wonderful songstress and advocate of alopecia and somebody that I know personally and is a sweetheart. So I'm looking forward to this event today. And I'm going to turn this over to our very own medical director, Dr. James Thompson.
Thank you, Chanel, for the warm welcome.
You're welcome.
Thank you. I'm thrilled about tonight. I'm just thrilled about the topic, hair loss. If it hasn't been a personal concern, uh, I'm sure at some point in our lives, everyone listening here, tuned in, that we've all known someone, a friend, a family member, a celebrity that has struggled with this or has had to embrace this. The public's interest in alopecia really took off a couple of years ago after a memorable Oscar event. Tonight, we're fortunate to have two fantastic guests to tackle alopecia. First up, we'll hear from a distinguished dermatologist, as mentioned, Dr. Donna Stockton. But before I introduce, I want to make a quick announcement. Our annual Kickstart to Plant-Based Eating will be returning this January. Last year, we had about 250 people signed up, and we averaged around 80 to 90 people in the room for 4 Tuesdays. So if you're interested in leading a healthier life, not just diet, but some lifestyle changes, then stay tuned with us and sign up for our newsletter, the Healthy Living with the Vision Foundation newsletter. We'll put a link in the chat box. Now, speaking of plant-based eating, here's a little inside tip. It may not be a magical cure, but it can help hair growth. And that is a diet rich in whole foods. That is your greens, your beans, your whole grains, your herbs, nuts, and seeds, while at the same time avoiding highly processed sugars and highly processed meat and dairy products. By doing this, you can reduce your level of inflammation, which is the key to many disorders that we are afflicted with, not to mention alopecia. But remember, while a healthy diet can help, it's not a substitute for being under the care of a dermatologist. And I'd be happy to dive into some of the more nutritional aspects later in this discussion if desired. Our goal for this town hall is for you to leave here with a more clear understanding of alopecia and what it is and how it's managed. And secondly, to get a personal get an account of a person that has experienced it firsthand, a celebrity that has experienced it firsthand. Now, let me introduce someone who knows more about hair than everyone else in this venue right now, Dr. Donna Stockton. I've known Dr. Stockton for 30 plus years, and we've shared patients for about that long. But we're both not that much older than 30, so we're still trying to figure out how that math works. Dr. Stockton is the president and CEO of Dermatology and Skin Surgery Associates. She completed her training at New York's Icon School of Medicine in Mount Sinai, and followed with dermatology training at Rush Medical Center in Chicago. She has, as mentioned by Chanel, a busy practice in Mokina in the south suburbs of Chicago. Dr. Stockton is highly respected by her peers and um, cherished by her patients, and I have the utmost admiration for her, personally and professionally. So without further ado, I will introduce to you, or I present to you, Dr. Donna Stockton.
Dr. Thompson, thank you for that introduction. That was absolutely amazing. It has been over 30 years. I miss you greatly, no doubt. And giving me the job of condensing a topic like alopecia into 10 minutes, I'm going to work very hard to do this. What I've decided to do is to divide hair loss or alopecia into different categories. I feel that that's the best way to approach it so that everyone can at least get an understanding of each category. I'm going to start with what is probably the most common, and that's alopecia areata for me as the dermatologist. Alopecia areata is an autoimmune process where, for reasons that are not clear, our immune system mistakenly attacks the hair follicles. The pattern in alopecia areata is usually patchy, and many of the patients present with areas where the hair has already started to grow back. The problem as hair is growing back in some of those sites, new patches can be forming. It can be seen on the face, I see it in the eyebrows, and different parts of the body. The cause, like I said, is unknown. I think one of the things that we can talk about a little later, and one of the other forms of hair loss, is inflammation. As we look at why certain drugs work in the immune system and regulation, we realize that there is an inflammatory process that triggers the immune system. And as we get more and more skilled with controlling the immune system, the drugs have become more specific. And I'll talk about those a little bit later. But in alopecia areata, there is a genetic predisposition. There are some environmental factors. Patients will ask me if it's triggered by some stressful event they went through. Other illnesses, for instance, lupus, thyroid disease, or vitiligo can also be seen associated with this disease process. Because it is usually patchy, we approach treatment with injections initially, except in children who don't tolerate it. In children, we do try to use topical immunotherapy. And there's some other drugs out on the market most recently that I will go through. The whole idea is to promote regrowth, which can be seen in alopecia areata successfully, and to prevent progression. If it does tend to progress and it's uncontrollable, alopecia areata can go on to become totalis. Alopecia totalis is just as it sounds, it's loss of hair over the scalp. This is considered a more advanced or aggressive form of alopecia areata. It is a more serious form of alopecia. Again, the same etiology. It is an autoimmune condition, again, where hair follicles are attacked by lymphocytes, T lymphocytes in the area. The response rate to treatment has improved with immunotherapy, and that includes another class of drugs called the JAK inhibitors. And those are the new drugs that I wanted to speak about. They can be given orally, and I've had much success Many of my patients are on alopecia treatment with the JAK inhibitors. However, they have to have at least greater than 50 to 70% of hair loss for the insurance companies to allow me to write for the prescription. If we don't control alopecia totalis for reasons that are still not quite clear to us, it can still go on to become alopecia universalis. Same etiology process, reasons for this progression we don't understand. A lot of these patients are completely healthy, no other medical problems at all. But this, as it sounds, is complete loss of hair on all parts of the body. This includes the face, all the body hair, arms, and legs. If you biopsy most of these areas, and this is in all of these alopecias, what you see pathologically is lymphocytes cratering the hair follicles and attacking the hair follicles that eventually causes their demise. As I said before, immunotherapy is a big treatment approach. I don't use corticosteroids in this group of patients. The JAK inhibitors, again, are being used with some reservation. And the problem with the JAK inhibitors, because they do alter the immune response, and we're just getting to know this class, it does have some side effects. So we follow labs both as we initiate the drug. 90 days later, you have to have had a tuberculin test. It has to be negative, and I prefer patients to not have any other medical problems going on. The next group, Dr. Thompson alluded to, which is probably one that everyone has seen in a family member or significant other, is male pattern baldness or female pattern baldness as we know it. This family is referred to as the androgenic alopecia. And what that means is there is a hormonal component. There can also be a genetic component to the loss of hair. What we know about these people is that the follicle has a sensitivity to the presence of the androgen. The androgen is testosterone and its derivative dihydrotestosterone. The typical male appearance is the horseshoe shape loss, beginning with loss in the crown and in the temples, the frontal area, and gradually progressing to, as it could progress to, loss across the frontal and into the vertex or the crown of the scalp. Treatment has always included a drug called minoxidil. We now also have Propecia, which is finasteride, which can be given orally. These classes of drugs are called anti-androgens as they block the binding of the testosterone and the DHT to the hair follicle receptor. Other treatments can include transplant surgery. There's always been some use of low-level laser treatment, and some men just shave their heads. In female pattern baldness, it too has a pattern. Etiology is very similar, where for reasons we're not quite sure, there's a genetic predisposition in that hair follicle has a sensitivity to the presence of the androgen. The pattern is as follows. If I were to part your hair down the center from the frontal region, I would be looking for a widening of the part. And this is progress over time. The severity can be absolutely related to how the family history of female pattern baldness has progressed. And in some cases, there's no history whatsoever, which is what makes alopecia quite complex. The hormone changes are significant in a sense that we see female pattern loss somewhere around 40s to age 60, and there's a reason. As women's estrogen levels fall, women do make a small amount of testosterone, and its partner dihydrotestosterone. And because the estrogen levels are low, you start to see the presence of similar characteristics to the male pattern baldness. It's more common in older women, but I see women in their early 30s, believe it or not, who do have that genetic predisposition to this pattern loss. As I said before, the treatment can be minoxidil, both topical or oral. I usually start patients out on a low dose, 1.5 milligrams, and I increase the dose depending on how well they do clinically. Postmenopausal women, I do give Propecia, which is the drug that was FDA approved for men. We can also compound minoxidil and the Propecia into a lotion type product, which they can apply at night before they go to bed. Of significance, I'm going to mention really quickly because it's one of my favorite treatments, is PRP, or platelet-rich plasma. That involves drawing someone's blood, isolating the platelets that are rich in the plasma, and in that theory is that they're stem cells. If the patient is healthy, they usually have healthy stem cells, and this is known to stimulate growth. I will combine this also with red light therapy, because red light therapy also can reduce that immune reaction in the skin, because we are in the hair follicles, because as I said before, a lot of these patients have high inflammatory components. Women also can have hair transplants. I don't see it as often as I do in the men, but it is possible and successful. I'm going to quickly talk about lichen planopilaris. It's not something that's commonly discussed, but the reason why I want to talk about it is I'm seeing more and more and more of it. Lichen planopilaris is an autoimmune process. However, it is an intense lymphocytic attack of the hair follicles. This is a progressive, quickly destructive process. It appears on all parts of the scalp. If not treated aggressively, it leads to permanent scarring. Historically, in the last 30 years, we'd used drugs like Plaquenil. Some people were using methotrexate, which we use in chemotherapy. Unfortunately, the JAK inhibitors are not successful in treating this. The biggest problem with this is that it does spread quickly. I see patients who usually come in with complaints. Usually the scalp is very red, it's irritated. You have these scaly patches at the base of the follicle. You have this kind of, it's called a footprint in the snow, kind of, where the follicles are standing like lone soldiers out by themselves. But if you look very carefully in the reddened areas, you can see there's a lack of hair follicles, and that's the destruction. Those areas do not usually recover. When we treat lichen planopilaris, the hope is to prevent spread. Very often we can't necessarily regrow hair in these areas. Again, it's an autoimmune disease like the others. You can talk about stress precipitating it, and that this genetic predisposition. Other types of diseases that are autoimmune, it can be prevalent in patients with lupus, or another rash that we see in dermatology, lichen planus. It's not my favorite type of hair loss to treat. I would refrain from sending these patients for hair transplants because, again, we're talking about a rapidly progressive process with inflammation, and most surgeons don't want to transplant into those areas. And autoimmune diseases are not predictable. So when someone is so-called cured, there's always a possibility of relapse. So surgical transplant into those areas is probably not such a good idea. Telogen effluvium, very quickly. One of my favorites. Why is it my favorite? Because it can be temporary. It's commonly seen in women who are have just had a baby, somewhere around 3 months is when we start to see it, to the 6-month period. Women will come in and the first thing they'll say is, I see hair in the bathroom on the floor. I see hair when I shampoo my scalp in the shower. And they usually will be frantic. We always look for the etiology. This, like I said before, can include pregnancy or right after childbirth. Menopause can trigger also telogen effluvium, as well as some hormone imbalances. We have to do some blood work. It too has an acute form, meaning that it can follow 3 to 6 months after, say, childbirth, but it has a chronic form. And that chronic form, which can be 6 months to a year or even 2 years, can be involved with patients who are menopausal. The new category of patients that I have recently been taking care of who have telogen effluvium is patients who have been on GLP-1s or semaglutides. And that's usually because there's a deficiency, iron deficiency or protein deficiency. Many of them, there is some muscle loss with a lot of these drugs. And I'm referring to the Wegovy's, the Ozempics, and the Mounjaros, and the Zepbound. So I also like to do a nutritional workup on them. So I'm drawing blood, looking at iron levels and vitamin levels, and replacing those before I do anything else. The majority of these patients also, I look at their medications. There are some medications that can give you this shedding, depression, cancer. Blood pressure medications can also lead to it. And of course, there's acute illness. And a good example would be the most recent COVID vaccine that we had, as well as COVID. A lot of patients came in shedding quite a bit of hair, and it was extremely alarming. So febrile processes too, or any kind of inflammatory process can lead to telogen effluvium. Treatment is always the underlying cause. It is a reversible condition in most. However, we want to make sure that each patient we approach early, and again, treat that underlying cause. I hope I didn't overwhelm. I will wait for the questions and answers. That is an introduction very quickly to alopecia. I have a lot more to say, but that's an introduction.
Well, thank you. Thank you so much, Dr. Stockton. I got a lot out of that. And as we spoke earlier, I have some familiarity with dermatology. So this was very enlightening and taking me back to what I remember. So thank you so much.
Thank you.
Now we're going to have Keya Trammell. So let me tell you a little bit about Keya. Keya Trammell is a dynamic force and Chicago Music Award winner for Best Female Vocalist. Seamlessly integrates her roles as a professional singer, makeup artist, actress, and alopecia advocate. Since officially launching her career in 2016, she gained widespread recognition when a cover song went viral, amassing 1.3 million views in a week. Keya's journey includes opening for Grammy Award-winning artists like Chrisette Michele, contributing background vocals for Lupe Fiasco, and starring in notable theater productions including Lady Sings the Blues and Reasons, a tribute to Earth, Wind, and Fire. Beyond her musical prowess, Keya boasts a 12-year tenure as a professional makeup artist, collaborating with renowned brands such as Bare Minerals, Ulta, and Benefit Cosmetics. Her passion for makeup stems from a personal connection to alopecia, inspiring her to teach makeup application classes and offer services for special occasions at a local salon. In the realm of advocacy, Keya is dedicated to spreading alopecia awareness, evident in her involvement with the National Alopecia Areata Foundation annual conference and BaldyCon. Recently featured in Vogue magazine for her impactful contributions to the hair loss community, Keya's overarching mission is to instill confidence through her multifaceted artistry and genuine connection with every audience member in the grand stage of her life. So without further ado, I bring Miss Keya.
Hi. Hello. It's so good to be here. Thank you for having me.
Thank you.
Yes, absolutely. Doc, you did a pretty good job at explaining alopecia overall. That was pretty
I
good.
tried.
You did it. You did it. Thank you so much.
Thank you.
On behalf of the alopecia community, we appreciate times like these where the focus is on alopecia and bringing awareness overall. We truly appreciate it. Thank you so much.
So, Keya, why don't you tell us a little bit about your journey?
Absolutely. At the age of 2 years old, I was diagnosed with alopecia totalis, actually. Um, it came out all kind of drastically, where it was my hair, my eyebrows, my lashes, they were all gone. Excuse my voice too. I've been singing all day, so my voice is kind of gone. Um, and then at the age of 6 years old, my all of my hair came back, and by the age of 9, it went to alopecia areata, which is, of course, patchy hair loss. And since then, I've had a patchy experience, I would say. Um, it's been an interesting journey. I'm very grateful to be now part of the National Alopecia Areata Foundation, which I get to, have a community of people who have alopecia, who feel confident in it, who feel less confident in it. I've been able to work with the American Academy of Dermatology now and go and speak at at gosh, I can't think right now, at Senate, at Congress, yes, and speak about different bills to get you know, medical wigs through insurance and all different things. I've been able to do quite a few things now, which I never thought would have happened. Being a young girl who was experiencing alopecia, I never thought that I would be now working with so many people who have alopecia and working with dermatologists. Like you said earlier, Doc, I was 12 years old getting injections in my head that I felt completely uncomfortable with. And I've also had the topical treatments where my complete scalp would turn purple. And then I was like, you know what? Forget all of this. I don't want
Yeah.
it.
Yeah.
And just be like, you know what? If I have patches for the day, or if I'm going to shave my head for the day, I'll do that. But there are so many people who still do desire to have hair on an everyday basis, and who are still having, these experiences. So thank you for the work that you're doing.
Mhm.
Absolutely.
So, Keya, tell us, how do you go out in the community? Tell us a little bit about the BaldyCon and the other things that you're a part of.
Yeah, absolutely. So back, gosh, that was about 9, 10 years ago when I did a video singing a cover of On a random day. And I decided to do a bald this day. Typically when I was doing singing videos back then, I would have a wig on or a hat on, and something was just like, you should do a bald. And I did it, and it went viral. And when that happened, I met so many people who were dealing with not just hair loss because of alopecia, but hair loss because of lupus, cancer, or just choosing to be bald. But of course, more than anything, people who experience alopecia. And when that occurred, the more I sang, the more I was on a platform, the more I was able to reach different audiences. And so, you know, I I learned early on, probably in that moment when I went viral the first time, that because of my personal experience with alopecia, I probably wouldn't have met this community who experiences the same thing that I do. Initially, years back, I reached out to the National Alopecia Areata Foundation, doing something that they call team up events, which was like with the White Sox or any national baseball league. And so I did something with them with that. And then I began to go to their conferences. And with their conferences, it was the first time that I walked into a room and I felt like a human.
Mm.
Like not the person that's coming into the room with alopecia, or the person that's coming to the room who's bald, or the person that's coming to the room that's a Black woman who's bald and has confidence and she can walk. It's just like, oh, I'm around everyone in this room who's experienced the same thing I'm experiencing, and I can have this beautiful symbiotic experience where we understand each other. It can just be amongst each other. It is beautiful. I'm 32 years young, and at that time, I was 30, and I was like, wow, this is what life is like. Okay, I enjoyed it. I will say there's a difference between the National Alopecia Areata Foundation versus BaldyCon. The difference is to be a Black woman at BaldyCon and to be a Black woman at the NAF conference. And it's beautiful to have connection to both. But at the NAF conference, it is predominantly of Caucasian descent. And it is triggered to mostly of, as you were speaking of earlier, the JAK inhibitors, the medicinal effect. So although that's beautiful at BaldyCon, I'm a Black girl living her life. And it's beautiful. And that's where that Vogue magazine cover came from, where they were there and we were just celebrating us, you know, being bald and being confident, and how long it took to get there. As I said before, when I was 2 years old, I was diagnosed with alopecia. By the time I was 18, I was in a high school classroom. The wig that I had on at the time, I was laughing. I'm super silly. I was laughing in class, probably distracted, and I should have been distracted. My wig fell off in class. My class laughed. My teacher laughed. I ran to the bathroom, and I had a moment with myself in the bathroom, like, why is this happening to me? As you were speaking earlier, Doc, about depression, how that can be a part of the alopecia experience. I definitely experienced depression. I definitely experienced low self-esteem. I experienced even suicidal thoughts because I felt disconnected from myself. Well, if I can't grow hair, then I can't be happy. If I can't grow hair, then I can't have this or you know, whatever. But to be connected to other people who have that, getting back to what you were speaking about, Chanel, being at BaldyCon, it gives me the experience to be connected with people who have my same experience and to be highlighted and to be adorned on and to be loved and be like, hey, regardless of whatever we're experiencing, as long as we have this connect, we can continue to like live life and enjoy life, no matter what or why we're experiencing hair loss.
Awesome. Wow, that's wonderful, Keya.
Thank you.
I want to ask you if you had any advice to give to someone
Mhm,
that just recently found out they have alopecia areata,
mhm.
what would you give to them? What would you say?
Your journey is your journey. It took me over 20 years to get to a point to where I was legit comfortable in my own skin. You know, right now I got a hair wrap on, but I take it off. So like right now, I shaved my head last night, so it's okay. But like I grow hair in patches, and like regardless, I'm okay. But it
Yes.
took me some time to get there. If your time to be bald or to not be bald, if you want to wear a wig, be okay with it. If you do want to get to a place where you want to, you know, showcase your baldness, baby steps. Or it might be a clear cut. When I was 18 and my wig fell off in class the next morning, I shaved the hair off that I had still left on my head, but I still wore a wig to school the next day. And I proclaimed my dignity with myself, but I still felt that armor with me. So take your time, love yourself, and that looks different for everybody else. My mother and my father, growing up, you know, they would take me to the mirror and say, tell yourself you're beautiful. And there would be times where I'd be like, I don't feel that way. I can't grow hair, so I don't feel that way. But my mom would be like, my mama's a Black mama. I don't care. You're going to do what I said do.
Right,
And
right.
I continue, to do that. And, of course, in the society that we live in, it's all about outer beauty. But if you look within
Mhm.
and say, oh, I like this part of myself. And that could just be, you yarning or you skating or you going to church or you talking to one of your best friends. Get into your coping mechanisms. The more you do that, the more you work on your inner self, the more you'll feel better about your outer experience.
All right. All right. Well, Keya, that is one. Oh my God. You just blessed us today. We appreciate that. Do you have any final remarks before we do a Q&A?
Thank you for having me. To put light on alopecia, I never thought as a young girl that this would be a topic that I would be speaking on often. I always thought that I was the only one in this world who had alopecia. So thank you for bringing light to this.
Mhm.
Thank you for your work. Thank you for sharing. And to everyone that's listening, when you see someone, let me say this. Couple rules, okay? If you see someone who has a bald head, don't just go up and rub their head, okay? That's not a thing. Ask for permission. Secondly, you don't have to do the Wakanda thing, okay? We enjoyed the movie just like you did. You don't have to do that to salute us. To say that you're beautiful, you don't have to say you're beautiful to be a bald woman. You could just say you're beautiful. And overall, once again, thank you for this platform to share.
You're welcome. Thank you, Keya. You know how I feel about you, so it's
I love you.
well received. All right. So now I'm going to turn this back over to Dr. Thompson.
Okay, thank you. That was so wonderful. Both of those were wonderful presentations and
Yes, they
very
were.
much heartfelt, Keya, and thanks for being in this venue. Um, I know we're not supposed to say it, but you're beautiful. I mean, just gosh, you rock, you rock.
Thank you.
Um,
So are you.
and my wife's on, and I'm sure she agrees. She's on the line. She's on her own feed, but it's great. It's really a fantastic experience here. So thank you, and we're gonna have this recording posted for those of you that I'm sure people are thinking, "Oh, I wish such and such could have been here and heard this or saw this." And so we will have this posted on our Healthy Living with the Vision Foundation website. So I'll start with let's see. I actually had a question for Dr. Stockton, but another question. Let me see. Something did come across my mind. You had said you had this as a very young child, and then you went through, I guess, several years where you didn't experience this. So I'd imagine, I guess, when it came back, your question becomes, is this how it's just going to be? I mean, you're young, you got several more decades ahead of you, God willing. It seems, I think I know the answer from what you've said, because you're looking forward, you're not looking back, and you feel comfortable in your own skin, as you said. But I know there are some people that struggle with that, feeling like, okay, when's the shoe gonna drop the next time?
Right.
Do you ever find yourself lapsing into that thought, or?
Oh, especially
Mhm.
as a young girl, absolutely. It would be times where I would have more hair than less. And at that time, I would get something called micro braids. And I can get braids that could cover some spots. And sometimes micro braids are supposed to last for at least, a month or two. And so I would wait, like, okay, I've had the braids for some time. Maybe my hair grew back and that. And I think that created a level of anxiety, right? Me waiting for that period of time and being connected with so many other individuals now who are younger than me. I see that is something that is consistent.
Well, I'd like to open it up if anyone else has a question, either in the chat, if they don't want to raise their hand.
Okay, looks like
They
Diane
can
has
put a
her
question in
hand
the chat.
raised.
All
Diane?
right.
I do have a question for Dr. Stockton, but I also want to just thank Tia for sharing her journey because it is so important for people who are having that experience to be able to connect with and hear it from someone else what it's like. So thank you so much for that. Dr. Stockton, I am wondering, are there any cultural implications around? I had two questions. Are there any cultural implications in terms of the how many people of color versus others have this? And are there any physical symptoms or anything that goes along with any of the types of alopecia that you discussed? Do some of them have some some physical health issues with it?
Absolutely. So just speaking about alopecia areata in general, um, there was a 2019 study out of the JAMA, which is one of my professional magazines, that we found that severe forms of alopecia appear in African Americans. And it's interesting that when you get to severity of disease, and this relates to almost every disease, high blood pressure, diabetes, that we see the severe forms in our culture. And I wonder, just look at my patient population, is that lack of access to specialists, and the actual just the lack of physicians to make the correct diagnosis in our culture. A lot of times kids will come into me who clearly with patchy loss have alopecia areata, but they've been misdiagnosed maybe as ringworm, and that they are on 2 or 3 months of antifungals for ringworm, when in fact, the reason for their hair loss is alopecia areata or an immune process. We do know that we as people of color are more prone to diseases that involve the immune system. And a good example is as lupus. When I take care of lupus patients, I would say the vast majority of them are Black. The vast majority of them are Black women. When I say the vast majority, I'm talking close to 90% are our people. With the severest of organ damage, kidney damage, cardiac problems, lung problems. And I have to feel that it has something to do with access to care, as well as a lack of making the proper diagnosis in our people. And one other thing about alopecia areata in our people versus Caucasians, Caucasian people can cover it for the most part. You know, they grow their hair long, they comb over it. But in us, it's very obvious what we have. The patch is visible. It's hard to cover unless you do some kind of microbraid or some kind of extensions, which I don't always recommend because the hair is weak around that area and it actually can make some of these conditions worse. But we as a people need to be able to access health care sooner. And we need access to specialists who can specifically address some of these less common problems. And when you ask about other medical problems, yes, there's a whole host of them, and many of them are just diseases of the immune system. Like I always like thyroid disease and lupus because I see so much of it. And also diseases of the metabolic system, and that would be diabetes. And most recently, there's been some literature, I believe it comes out of U of I actually, where we are seeing more alopecia in patients who have diabetes. To answer your question. Yeah,
Thank you.
your territory there, U of I.
I know, right? Deborah?
Yes, thank you. I have thoroughly enjoyed this presentation, but this question is for Dr. Stockton. Dr. Stockton, I have, it's personal, I've experienced a lot of stress, and when you're in the thick of it, I see hair loss. And so It could be, sometimes you think it's your imagination, but is there a connection between stress and hair loss?
I believe so. I believe that we don't understand all the elements of the immune system. We know that the immune system responds to different changes in the body. And, stress, as I said before, can include disease processes, or it can include you not sleeping well and the onset of depression. So all of those can lead to, like I was talking about, telogen effluvium, or stress and alopecia areata, again, an autoimmune disease. The presence of stress weakens the immune system, and clearly stress in people of color, we know that there's a higher incidence in our people of high blood pressure, diabetes, and I believe that is all due to just stress on a culture, and again, lack of access to care. Um, but stress is everywhere, I would imagine. There's also a genetic predisposition, to how you respond to stress, and whether or not you can find the outlets in terms of therapy and biofeedback and all of those other things that we talk about. Having that self-care moment when you can actually put yourself first. And I find this a lot in my women. Women have a tendency to carry the cross for everyone. And when I sit down and I talk to them, they talk about their kids. They talk about their significant other. They talk about their workplace. They talk about what happened in their workplace. That all plays a part. It weakens us. And yes, it affects your nutrition, your ability to absorb nutrients. It affects your microbiome. There's a whole host of things that cascade along. So to answer your question, yes.
Okay. All right, Dr. Wheeler?
Hi, everybody. Dr. Stockton, thank you so much for your presentation. I have two questions for you. But before that, I want to say something to Keya. Keya, thank you so much for your witness in this journey. And I want to thank you for being that picture of how alopecia and confidence can coexist. So thank you so much for that. And also, I want to tell you, she's a wonderful makeup artist. She actually did makeup for me at one point. So thanks again.
Thank you.
You're welcome. So Dr. Stockton, two questions. So I'm a primary care physician. And when I send a patient to the specialist, I try to do some things prior to the referral to just make sure I'm covering the possible underlying conditions. So as a result of some things that you said, I'm thinking I need to check nutrition status and maybe their lupus status. Is there anything else that I might do ahead of the referral?
So depending on the actual age of the patient, the workup that we do for hair loss is as follows. We look at the CBC, we're looking for iron deficiency anemia. We look at the ferritin levels. The ferritin reflects the actual iron stores. A ferritin level less than, say, 14 can actually be associated with alopecia with a normal serum level of iron. So check the ferritin levels.
Okay.
The other thing I like to look at is vitamin D. That's definitely associated with hair loss. And in my women, for some reason, a greater number of them are vitamin D deficient and require replacement. So we looked at the CBC, we've looked at vitamin D, we've looked at ferritin. I also like to look at B12. And I look at B12 because back to my friends who are on the semaglutides, Wegovy, their absorption in the gut is different for reasons that are related to the drug itself. And so they actually should be on vitamin B12, but many of them are not. So check that level as well and watch your patients on those drugs just to be sure you're covering all the bases.
Yeah, it's funny you should mention that class of drugs. Of course, it's very popular now, and I have a lot of patients coming in wanting to get on it. And I really have sort of mixed feelings about it, particularly the ones who are wanting to push the dose to the higher level so that they can get the weight loss. But what they're not understanding is that just because of the way the medication works, you're now putting yourself in a position of starvation. And so now you're
Correct.
getting no nutrition.
Correct.
So
You're
I
getting
think that,
muscle wasting.
yeah,
And
exactly.
that's what I see. I think my biggest problem in my field is, and I hate to put the weight back on the med spas, but in my area, med spas are dispensing that drug. I don't worry about you guys dispensing the drug. I realize that my fellow physicians know to do blood work. They're following for muscle wasting. They're looking at nutritional sources and what they should manage. But these med spas are not. These med spas are actually cash transactions.
Exactly.
And those patients are seriously at risk.
Well, and even the compounding pharmacies, I think before semaglutide came through, nobody had even heard of. And I'm thinking that's a total cash cow for them. And
Oh,
so,
totally.
yeah, yeah. So there's some issues
Totally. The
there.
amount of money is unbelievable. We're
Mhm.
talking about billions and billions of dollars in the industry. And even some of my plastic surgeon friends are selling it out of the office. And the doctors are not even involved. There's usually a mid-level who manages these patients. And as patients start to lose muscle, hair, that's a whole nother level of therapy.
That they're not prepared for,
They're
and that
not prepared for.
they have not prepared their patients for.
Correct.
So my other question is this. So should I expect that a woman who has, or a man who has alopecia, no, let me take that back. The woman going through menopause, should I expect an acceleration in her alopecia?
Not always.
Okay.
Not always. I think that a good history, uh I usually find in my menopausal women, again, I'm looking for vitamin deficiencies. Um, but there's some menopausal, postmenopausal women that don't really experience hair loss.
Thank you so much.
You're welcome. Nice to meet you, by the way.
And you too. You too.
All right. Does anybody else, Kia, you have something to say?
I do. So, Dr. Stockton, are you saying that if you have more B12 or vitamin D, that it can be an opportunity for hair regrowth?
You're not taking more than your body actually needs.
Okay.
So
And
you don't necessarily pack it on and see more hair growth, but if there's a deficiency, then we try to bring you up to what we consider to be uh, normal levels. And I even have questions about that because every lab is different. Every individual is different in terms of what their natural level should be. So we try to come within that area, and I still very closely counsel the patient. I
okay.
think the hardest part about hair loss is that it's multifactorial. So a patient comes in and they have thinning hair. There's a whole host of reasons that we never even really talked about that need to be discussed with that patient. It's a long consultation.
Yeah. Yes. One more question. I heard you speak about low iron. Do you feel like that
Yes.
also has a parallel to hair loss as well?
Yes, 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 yes. So it's another common problem is particularly with menstruating female. So your age group, right? You're busy. We check a CBC when you come in, but it's not always discussed. And those that are borderline have heavy periods. As you get into your 40s and 50s, we start to see, especially Black women with fibroids who
Mhm,
bleed more,
mhm,
the iron levels start to drop.
mhm.
And those are the people that we worry about. We want to replace them. But like I said before, Even if I see that your iron levels look normal, I want to look at your iron stores and I replace those because you can continue to shed if your iron stores are low. And
Mm.
I've seen that. So if, like I said, a ferritin level, which reflects your stores, less than 14 in dermatology, we replace that. We bring that iron store up.
Okay. Thank you so much.
You're welcome, beautiful.
All right, in the chat, real quick, we have a message from Deb Hurston, and she's asking, what is a natural way to manage inflammation?
That's a toughie. Dr. Thompson?
Yeah, I'm so glad you asked. Well, yeah, inflammation. I'm not aware of studies where a specific food will lead to more growth of hair, a specific food. We talked about deficiencies. Dr. Stockton elegantly, and I completely agree about deficiencies in certain things like vitamin D and ferritin and your iron source. Those have clearly been associated. And if you are at a deficit, it may actually help with hair growth or regrowth. But the bottom line when it comes to inflammation is reducing inflammation overall by eating healthier. So foods like green leafy vegetables and beans and greens, the things I mentioned at the top of this hour, those can reduce your level of inflammation. They have shown that inflammatory markers, certain interleukins, something called C-reactive protein, a number of markers have gone down that show that your level of inflammation goes down. And so inflammation comes from a lot of different sources, from autoimmunity, it can come from toxins, it can come from too much sun. There are a lot of different things, but by you having your immune system more robust through healthy eating and by eating more fruits and vegetables and less foods that drive inflammation, dairy products, saturated fats, they tend to drive inflammation. So there are accounts, not studies. There are accounts for people with alopecia areata where they have dramatically changed their diet, made it more healthier, and experience better growth of their hair. There's a very reliable site called pcrm.org on YouTube. It's called the Exam Room. And just in the last few months, I believe, may have been the last 6 months, there were some twins that had alopecia areata that experienced, they went through a lot of different trials and tribulations with their doctors, and they ended up going to plant-based and diets, and they had really great outcomes. But my experience with, and that's not a study, that's just an experience, but I think putting it together, having a dermatologist guide you and reinforcing that with that healthy eating, and relieving stress. We've talked about stress as well. Stress clearly plays a role in many chronic diseases. So maybe meditation, maybe yoga, making sure you have enough sleep. All of these things together may give you a better outcome. The B12, you have to not only be careful with the GLP-1 agonists, like Wegovy and Ozempic, Mounjaro, ones that Dr. Stockton mentioned, but you have to be careful if you take metformin, then you have less B12 absorption. If you take antacids, acid blockers, you have less B12. If you're just over 50, you don't absorb as much B12. And those levels can be checked. Your B12 and vitamin D levels can be checked. I agree with Dr. Stockton. You have to be careful sometimes with the numbers in the labs and all that, but go on, be under your doctor's guidance and make sure you have all those buttons pressed. But healthy eating can help, just as it can reduce your cancer risk and reduce your heart risk, the number one killer of people, male and females, heart disease. And so what have you got to lose? And you certainly may have something to gain in terms of hair growth. Thanks.
I wanted to add something about as far as nutrition. We also find that sugar is an inflammatory agent, and you should check your labels. Sometimes it's pretty shocking how much sugar content is in the foods that we eat on a daily basis, but that's also inflammatory, and that's a pretty easy way to decrease some of the inflammation in your life.
True, and it's really that processed sugar. The natural sugar you get from the food usually doesn't do that, and that's through those insulin spikes. And insulin resistance leads to higher levels of inflammation. So that's very true.
Okay. All right, so it looks like that's about all of the questions that we have. Please feel free to add some questions and we will respond back. I did want to let you guys know about an upcoming event that we have also with Healthy Living with a Vision in collaboration with Lambda Kappa Mu for the importance of immunizations. And our featured speakers is going to be Dr. Angela Wheeler, who is our family medicine physician, and Dr. James Thompson, our allergist and immunologist. And that's going to be November the 10th. And it's going to be via Zoom at 5 p.m. And everybody on here, I'll make sure that I send you the link in regards to that. Any closing comments? If not, I'm going to turn it over to Dr. Johnson. But Dr. Stockton and Keya, thank you again. We really appreciate you guys. We really do.
My pleasure.
Mhm.
Loved it.
Dr. Johnson?
Thank you
Good
so
evening.
much for having me.
Good
Thank
evening,
you.
everyone. This has been just so phenomenal. Once again, from our medical experts, but also special shout out to Dr. Donna Stockton. And as I reminded her, she was my children's dermatologist, about 25 years ago. And
Yikes.
Keya, thank you so much. You are so inspirational. And I do want to share this about Keya. We always are all about supporting one another and collaborating. So hopefully this will be an ongoing relationship we can have with both you and Dr. Stockton.
Thank you.
As an optometrist, I do have to say we see inflammation in the eyes all the time. So a lot of these inflammatory diseases we see that show up as dry eye, and that might be one of the very first symptoms of autoimmune disease, dry eye, as well as in diabetes. One other thing, when people lose their lashes, one other cause of that can be actually dust mites in the lashes, which we have great treatment for. So that's a little bit about how I look at the eyes in terms of connecting the dots with the whole person. And then finally, we are looking for people, we're looking for advocates. We are looking for ambassadors for healthy living with a vision, our foundation. We need people to spread the word about decreasing and eliminating healthcare disparities. Dr. Stockton spoke about lack of access to specialists, which is so very, very true. And a lot of times people just don't have that access, or their insurance plans may have very few providers and they have to travel many, many miles to see subspecialists. So that puts a lot of pressure on the primary care physicians um, to try to help their patients in so many ways. So, but what we talk about in our health panels is what kind of questions to ask. um, how do you address your primary care physician? And I always tell my patients, if your physician or doctor, optometrist or ophthalmologist does not have time to answer your questions, find another one. We're fortunate to be in an urban area, Chicago, but this is even more pronounced in rural and mid-America areas. So, but that's what we're about, trying to connect the people with information and motivation. As I mentioned, if you are interested in helping Healthy Living with a Vision, be an advocate, be an ambassador, please put your email in the chat section or visit our website, healthylivingwithavision.org. We also welcome donations. Please, please, we need donations so we can carry on. Everyone on this panel is a volunteer. We have some ongoing projects. We have a golf outing, our first big golf outing in July, that we're looking for sponsors. We also are big in terms of in the springtime have an autism awareness program we're a part of, lupus program that we do in the spring. We have just so many projects that we want to do to get information out to the community. So please, everyone that's on this call, you can be an advocate, you can be help us put that knowledge out and sign up for our newsletter on our website. So with that, I will cut this short, and everyone be well, see well, be blessed, and we look for you all on our next forum. Thank you.